Urogynecology is a subspecialty within urology or gynecology, where we focus on female pelvic issues like urinary incontinence, fecal incontinence, and pelvic organ prolapse. Within urogynecology, I have had patients who have finally found someone that understands what's going on with their gynecologic issue. A lot of the times, my patients will see their primary care doctor, their gynecologist or urologist for, let's say, urinary leakage, and not quite get to the reason why they may have developed that. So seeing a urogynecologist can be helpful because we pay attention to all the things that can affect the pelvic floor. So it involves a little bit more of a detailed pelvic exam and kind of discussing our exam findings and how that relates to our patient's symptoms and how different things can be helpful depending on what our findings are. So the pelvic floor is what supports our pelvic organs. So it's made up of muscles, tissues, ligaments, connective tissue that keep everything in place. So a woman should see a urogynecologist if they're having issues with their pelvic floor. Things like urinary leakage, accidental bowel leakage, pelvic pressure or vaginal pressure. That could be a manifestation of pelvic organ prolapse. We certainly see more complex pelvic floor disorders, things like vaginal fistulas as well, although those are quite rare. So the treatment for pelvic floor disorders isn't always surgery. We kind of customize it and personalize it to the patient depending on their goals and their health status. So we can offer things like pelvic floor physical therapy, pessary management, things that aren't necessarily surgical interventions, but procedural, let's say Botox injections or urethral bulking. And then if they are interested in a surgical intervention, there's advanced therapy options that we are specifically trained in fellowship to offer our patients. I had a patient with dementia who came to see me with their family. And their family advocated for the patient because that patient didn't quite know what was going on with her pelvic floor. She had significant pelvic organ prolapse, which we would call a stage 4 when everything is outside of the vagina. She also had significant urinary leakage and accidental bowel leakage. And ultimately, I was able to help her by giving her the option of having a surgical intervention that was appropriate for her health status and age and their goals. And we were able to help with her pelvic organ prolapse, put everything back to where it's supposed to be, and helped also with her urinary leakage. So ultimately, we had the best outcome for the patient. She did really well after surgery, and seeing her and her family happy with everything that we had done for her was very rewarding.